Hello, and welcome to When Life Gets Tough, a podcast that tackles timely and relevant mental health topics in an easy-to-understand way for all. I'm your host, Katie Curtis. I'd like to start today with a brief note that our episode will contain content surrounding suicide. If you feel like these conversations might be a trigger for you, please use discretion when listening. As always, our counselors are available 24/7. If you are having thoughts of suicide or need support, you can access our local crisis line at 319-362-2174 or simply call or text 988. Today we have Simon Kalkbrenner, who serves as our Zero Suicide Coordinator with Foundation 2 Crisis Services. Thanks for coming, Simon.
Hi, thanks for having me.
So we're really excited to learn more today about what happens at the Crisis Center. So the Zero Suicide Initiative is your role. We want to learn about that, how it works with the Crisis Center, so many things for us to talk about. So first, can you talk just a little bit about your Zero Suicide Coordinator role at Foundation 2?
Sure. So the way that particular role works is we have 11 different substance use agencies in the state that have residential facilities and are also state run. And the counselors there will identify people who need extra support, whether that's because they have a history of suicidal thoughts or have suicide attempts in their past, or if they're currently experiencing any suicidal thoughts, or if it's just someone that they've identified as needing some additional support after they're leaving residential treatment. Because that time going from residential, where you have 24/7 support, and then leaving that and a lot of that support is then gone, I come in and follow up with this person at 24 hours after they leave, 7 days, 14 days, and then beyond that as needed, just to make sure that they're doing okay emotionally, their mental health is all right. I check in about suicidal thoughts and make sure that they are connected with any other resources that they may need to help support their sobriety.
Can you talk a little bit about what kinds of resources you're providing to folks when they say, actually, things are really hard, I need more support? What kinds of referrals can you make for them?
Sure. It kind of depends on which area they're struggling in. So primarily my role is crisis counselor. So that's where I'm going to start with. Sometimes when I call them to check in on them or they reach back out to me, if they are currently in crisis and need just help de-escalating, need help coming up with safety plans in some instances, in a few instances needing help getting connected to emergency services to stay safe. And so that's where kind of my focus starts. And then as we know, you need your basic needs met as well to feel all right. So sometimes that means talking to them about local options for financial support, for housing, things like that, making sure that they're connected with outpatient treatment if that is something they want, making sure they're connected with mental health therapy if that's something they want, and providing those numbers so that they don't have to spend all of their time adjusting out of treatment and searching all these numbers. It's easier for me to have all of that at my disposal and then just send them the information so that they can act on it.
And what do you generally find that people are needing immediately post-discharge in a residential treatment? Are there themes maybe in the emotional experience people are having, or themes in the needs that they have after that?
There are. It kind of depends on the month as well. So like in winter months, I see a lot of housing needs more often. In around the holidays, there's a lot of family and interpersonal support. People need help talking through just being around family members that maybe they have had rough experiences with due to their substance use disorder or their mental health.
And that makes sense too, because family functions a lot of times involve substances, particularly alcohol. So if you have somebody who's in recovery and really is focused on that, I imagine navigating that both in having conversations and maintaining their sobriety can be really challenging.
Mm-hmm. It can be. And then if there's a relapse in that time, I do a lot of counseling around, forgiveness of themselves and being okay with the fact that this is part of treatment. We have a lot of conversations about their counselors are not going to judge them or be angry at them, and encouraging them to reach out to that counseling support. A lot of times immediately after discharge, They've been in residential treatment for, 28 days, sometimes even longer than that. And so the first couple of days, it's a lot going on all at once, a big transition, a lot that they have to focus on and kind of overwhelming, and they haven't really had a chance to settle into what that feels like now. And so that 1 week follow-up is where I see a lot more of, actually my mental health is not doing so great. I'm feeling stuck. I was overwhelmed, but now I feel like I'm not doing enough. And so that 1 to 2 week area is where it kind of starts to sink in a little bit more that that support they had is gone, that big change is done, and so now what? And then I can come in and help with, all right, let's make a plan for now what.
Yeah, I appreciated when you made the comment that sometimes the intervention itself with you over the phone is really where maybe they find some peace, and that's what they need. Because we always, as a provider of a crisis line, like to remind people that the intervention itself, calling the crisis line, that sometimes is the sole intervention that will support a person and maybe coming down from a crisis cycle or having thoughts of suicide. And doing that safety planning and that conversation is a really valuable way to gain support when you're struggling with a crisis. Can you talk a little bit, in your opinion, about why you think services like the Zero Suicide Initiative are so important?
I think just giving people as many resource options and as many people paying attention to what's going on with someone is going to make everything better as far as their mental health, their chances of sobriety, because it definitely takes a village. It can't just be one person trying to go through it by themselves. And then the Zero Suicide Initiative started with inpatient hospitalization as well, and just really focusing on our healthcare providers in general asking and talking about suicide, because that first 2 to 3 weeks after leaving treatment of any kind is a very dangerous time for people. Anytime someone is stepping down in the level of care they're getting, being able to replace that, whether it's with someone like me who is actively reaching out and providing those supports, or helping teach the patient how to find those supports themselves so that they don't feel like they've just been abandoned by the care that they were getting.
Yeah, that makes a lot of sense when you think about inpatient settings. They're so regimented. They know what, they being anybody who's experienced that setting, know exactly what's coming next. They know when meds are happening, they know when therapy's happening, they know when skill session's happening. And then to just say, okay, congratulations, we're proud of you for being sober, but now go out and live your life. It provides a lot of freedom to people who've become so, comfortable with that routine, and routine's really important. I'm curious, what drew you to the role, Simon? Why did this position speak to you?
I enjoy working in crisis services and in mental health. I know that people are having a very rough day when they're calling in or they're reaching out for support, and I like being able to sit with someone and say, we together are going to work on something. We're going to come up with a plan between the two of us to figure out what will work best for you. It feels more natural to do it that way versus sit there and say, okay, well, here are the things you need to do. Doesn't matter about your input. Go ahead, have fun, good luck.
Mm-hmm. Yeah, and I think it's great. We need people who want to be in crisis services and want to work in the mental health field. And there's a lot of people who thrive in crisis who can take people's chaos and really find calm in it and be that thing that helps balance people out. So we're really grateful that you're here and grateful in the role. Can you tell people a little bit, can you maybe actually just paint a scene for us? So in a realistic situation, how would interacting with your services work? Maybe an example of an intervention you've had with someone when you've seen a really positive outcome.
So whether it's someone calling into the crisis line or me calling out to someone, the conversation is generally going to start with, how are you feeling, or what is going on today? So if someone is calling into me, the question is, what have you calling into us today? To kind of give them the space to open up about whatever it is that's going on and let me know where to start with that intervention. A lot of times it's either someone is having thoughts of suicide. We get a lot of calls about someone is having a lot of anxiety or feeling like it's a panic attack and just needing some help calming down from that. I had a call that I was on with someone that had been referred to me, and they weren't sure whether or not they actually wanted help at all. When we were on the phone with each other, they had called in and had just experienced a relapse and was feeling a lot of guilt and shame over it, and telling me, I don't think I want to go back. I can't go through this again. They're going to be so mad at me. And feeling very worried about the way their relapse was going to be perceived, and just spending some time talking with them on the phone, letting them know, as professionals, they see this. I personally have never talked to anyone who's been through a sobriety journey that hasn't experienced some kind of relapse. And, that the counselors are there to support them. They've been through this kind of thing with a lot of other people before, and we just were able to talk through all of their fears together. And they were able to then go back and get into the same treatment program they had left to continue working on the support that they needed.
When you screen for suicide, what does that include? So what kinds of questions are you asking? How do you know or rate severity based on the suicide screener we use?
So with suicide, and this is for anyone who's asking about it, but especially with us, being very straightforward and plain with the language, using the word suicide and saying, are you having thoughts of suicide today? And depending how that answer goes, sometimes it's a straight yes, sometimes it's no, I've never had that. Sometimes the answer comes in a little bit more of not really or not today, and then that requires a little bit more digging in, what does not really mean, or maybe not today, but when is the last time you felt that way? To try and get an idea of how often the person that we're talking to is having thoughts of suicide, if it's a daily occurrence, if there have been past attempts, is also going to be another question that we ask. Have you acted on these thoughts of suicide? Have you attempted suicide in the past? And just making sure to be very straightforward with the language instead of going around it and saying, do you want to harm yourself? Have you ever tried to harm yourself? Because that's such a gray area. And we want to make sure we're really getting at the heart of how a person is feeling.
Yeah, when we teach assist, we often talk about clear and non-judgmental, right? Mm-hmm. So you're not thinking about suicide, are you? As the obvious example of nobody's going to want to say, yeah, actually I am, if you ask it in that manner. And we also use the example of self-harm, right? We don't want to ask about self-harm because somebody might be thinking about self-harm, but not thinking about suicide or vice versa. So any opportunity we have to be as clear as day in that situation is really important. Another thing that you were saying makes me think of when we talk about themes of suicide or people with past attempts is we can have an opportunity to use that as a strength and say, you have had a past suicide attempt. Tell me what worked in the past. So, or past thoughts of suicide. Tell me what worked. What got you through that the last time? Is that a strength we can use this time to help you get through a similar situation? So, Simon, I'd like to wrap with you sharing any advice you might have for somebody who is experiencing maybe a mental health crisis, a mental health diagnosis that they live with, in existence with a substance use issue. And when we think about those two things, what are the best ways that they can take care of themselves, or maybe if somebody's a caretaker, they can take care of that person?
I think the biggest thing that I would recommend for people off the bat is find one person at least to talk to about what's going on. Ideally, that person would be a professional who can point you in the direction of, seeking out care, but even just opening up about it for the first time. One thing that I hear often on the phone is the phrase, I've never talked about this before. And so just having gone through the process of saying it out loud to someone else for the first time can be an enormous step forward in getting the kind of help that someone is going to need, whether it's mental health or substance use, or they are dealing with a combination of both.
Great. Thank you so much for joining us today, Simon. As always, if you or someone you know needs mental health support, Foundation 2 Crisis Services is here for you. All of our services are free, confidential, and available 24/7. If you need support right now, you can call the crisis line at 319-362-2174 or simply call or text 988. Thank you for listening to When Life Gets Tough. We hope you will join us next time.